So I'm just pulling my presentation up and I'll get started. So this presentation today is going to be on really our global healthcare management program. It's a very innovative program. There's really nothing like it in across the UK in terms of being able to not only get a master's degree in global healthcare management, but to get a specialism within that, which is so important today with how the healthcare landscape has evolved and the need to have an expertise. So first of all, before I get going, I just want to tell you a little more about the Global Business School for Health, just in case you don't know that much about us. We are the first business school in the world totally dedicated to educating the next generation of health and healthcare managers. This school was really established with the insight of recognizing how important health is and health care. Of course, we've all been living through a pandemic, and so health services and conversations and news about healthcare and the healthcare sector and its ability to cope or not cope with the pandemic has been important. But actually, if we look back over the last 10 years, we've seen that the health sector has been growing at an exponential rate, not just here in the UK, but across the globe. And part of it is because in many countries, like in Europe, Japan, we see aging societies and the kind of demographics shifting away from societies where the majority is in a younger cohort to a demographic where the population is made up of more and more elderly people who need more health care. But even saying that, we can look across and see that different lifestyles, changes in people's behavior has led to more and more non-communicable diseases. We also see the impact that climate is having. So we see more people with cancer, with diabetes, strokes. So many of the things that, are, often associated with certain countries now has spread globally. So it doesn't matter if you're in a low income country, a high income country, or a middle income country, healthcare is increasing. There's also, I think, a bigger awareness about inequalities within our society that not only impact our incomes, but impact our lifestyles and our ability to have a high quality, healthy life. So to address all of these, there's much talk about having lower costs, better quality, and more access in healthcare. That's a big or tall order for a system that's already very strained. So what we need to do, and what we really have done in the Global Business School of Health, is try to really reimagine what that health ecosystem can look like. What kinds of jobs will be needed in the future? What kinds of skills that you have already that can be transferred into making a difference in this healthcare landscape? So that's a real important, and what you'll notice that's very exciting about the Global Business School for Health is that all of our programs really push on that kind of cutting edge thinking. We also recognize that sometimes there has been a narrowing of actually thinking about health. We often think about clinical individuals, or we think about public health. But really, where we see a lot of the growth and change is in business health, that area that's kind of bridges between. We see more companies coming into the health architecture. We see, things like Amazon, Google, Microsoft. We see big tech also coming in as more and more of our thinking is that we can't just keep treating patients. We need to help work with our societies, with our populations, to prevent and diagnose diseases earlier to really make a difference. So that's really what the Global Business School for Health is about. As the director, I'm extraordinarily excited to be able to present to you today one of our real exceptional programs that I think will give you as a student an opportunity to really think out of the box, expand your horizons. If you're already in health, to really get a fresh perspective learn some new skills that are really all forward thinking. And that is what these programs are about. So just a little more, I will give you a general overview of the program. Then I'm going to go right into really some more detail. And then we're going to talk at the end just about career opportunities that will be available for you. So this program really has been designed to give you, first of all, an overview of the kind of contemporary healthcare landscape, and particularly to develop your leadership and management skills. And I think in that sense, it's so important. You'll get the theories, the principles and practices, and you'll take a number of core modules that I'll talk about in just a minute when I take you through the program structure, that are really designed to make sure that you understand and have those business and management skills, but through a healthcare lens. Then there's also this opportunity for you to dive deep, to get a much deeper understanding of a particular aspect. Now you might ask me, why did we pick analytics, finance, leadership? It's because we did extensive market research with employers as well as prospective candidates, not just in one health system, but across the globe. And through that research, these areas came up as the top areas that employers told us they really needed competencies within their staff and their leadership team. Of course, analytics, the world is getting more data focused. And many of us really are not keen to be necessarily data scientists, but we want to be able to use those. And we need to understand that landscape, how AI works, how the algorithms work, how we can really harvest from our data through our electronic health records, the kinds of information that we need to make decisions. And then last but not least, how do we take that data and visualize it into a story that we can really deliver to others to understand and make decisions? So analytics couldn't be more important than it is today in terms of where healthcare and health is going. So this program is really designed to give you that root in analytics and that skill set so that you can be the person who really understands not just the business and management, but can take that, ask the right question, interrogate it, and move it forward through data. Then, of course, finance. We often talk about costs. Today, there's a lot of thinking about value-based healthcare. And so what does that mean? How do we look at outcomes rather than inputs? And how do we cost those and understand resources? The other big challenge is to look at healthcare and health expense not as a negative externality or a cost, but to look at it as really an investment. So again, understanding the finances, understanding accounting records, understanding how to manage and risk within a financial setting. All of these things are terribly important to taking healthcare forward. I couldn't emphasize more that the costs. Today you have countries spending between 10 and 20% of their GDP on healthcare. It's not a question of whether that's right or wrong. It's whether or not there are ways that we can continue to spend money on healthcare while also increasing the kind of value that we get, making it more affordable, making access, but keeping quality up. Those are huge challenges, and they all have resource implications. And then last but not least is our leadership route. And again, when we spoke to employers, leadership, but not just having people understand leadership management. They want people who can do change management, who understand how to get the best out of their people, to go through an innovation process, to drive and embed innovation. And myself, in many conversations I've had with people around the healthcare system, they often say to me that we're not lacking ideas, we're not lacking innovation. What we're lacking are leaders who can really inspire and embed that. And that's often not an easy task when you've got labor shortages particularly in key areas where people often feel demotivated. And so how do you then turn and really make those kind of change processes that are integral for the future? So this is a really important area, and it's about also learning your leadership style, learning how to alter your style when you need to, how to understand stakeholder engagement, how to be more self-reflective. And if you can learn those skills early on in your career, the kind of bounce that you will get throughout your career will be tremendous. So I'd also like to then just highlight to you the entry qualification for this program. This is a very competitive program. And, so you do need to have a 2-1 UK degree kind of qualification or equivalent overseas. That's really important. If you've got work experience as well, that's a big, big plus as well alongside this. In terms if you're an international student, you'd need to have an IELTS of at least a 6.5. I believe it says 6 in all the sub areas, but I believe that that's actually not a 6. That is a that's not a 6.5. That's a 6. So I think that just to make that correction, you will submit a CV, a personal statement, and personal statements are read. They're very important, particularly in a competitive program, showing your interest, your journey, why you're making this decision, and also your potential. What do you want to do with this degree? Where do you see yourself going? All of that's very important. So the personal statement doesn't need to be that long, but it does need to be concise and really help us understand your motivation for applying for the program, how you see your background fitting into that, and then where you'd like to go with your degree once you get it. And then also a reference. And that reference needs to be a really good reference. So you need to make sure that the person who writes that knows you well enough that they can speak to you. Sometimes I see references, they're very generic, and they don't show much of an understanding or a relationship, or they don't speak to the program the person is applying to. So spend some time, make sure your reference and whoever writes that is able to give you the kind of reference that you're looking for to get into this program. So who is this program for? Well, this program is for really, you can be a new or recent graduate in health, science, business-related fields. We're not that concerned about what you've done as long as you've got that kind of basis of knowledge, because this program allows you quite a bit of flexibility given the routes to identify an area that you want to go into. But, it is, so social sciences, health, business, medicine, those are all great areas for coming onto this program. And that you might already be a manager, you might already be in healthcare, and that relevant work experience is really important to us. So, it really speaks to a wide group of people, and that's the idea. We want to bring people from different backgrounds. You can be in pharma, you can biotech. It's about really bridging that gap and creating a community, a cohort of individuals who are really committed to making a difference in health and healthcare. So I'm going to now just turn and speak to you a little more about the actual program. And I want you to really understand what your experience would be like. Now, before you start, all students will be invited to complete an unassessed kind of self-paced course in global health. The reason we have that course is because we want everyone, first of all, we all come from different health systems, and health systems can be quite contextualized and cultural also. So it's understanding where everybody else is coming from. This course is actually an excellent course. It's something we're creating in-house. We have a visiting professor, Mark Brunel. He's a senior leader at KPMG Global Health. He has written a book called In Search of the Perfect Health System, And this course has been designed by him and myself for you. And it's really a great opportunity to understand different health systems and to understand the differences as well as the commonalities. So that when you come into the classroom, you've already got a kind of global perspective. And as you meet other people on your program who come from other health systems, that you can have that as kind of an anchor, a start to this very exciting program. So once you've enrolled, the first thing you'll be doing before you even show up is getting access to this course so that you can go through it online prior to joining us. Then you'll have a 1-week induction. In addition to learning about your program and timing and timetables and those sorts of things, it'll be a great opportunity. We've got some exciting events planned to really allow you to start to join and get a sense of belonging as a cohort. This is an in-person course. And so you'll have a whole week of activities. It's going to be just really exciting. We also will be, doing a lot on your personal development, your professional development, helping you. We start with career services, not in January, but in September. Because as a PGT on a 1-year program, you need to start on day 1, visualizing where you want to go, what work you want to do. And if you're an overseas student, at the end of this, you might decide to take a post-study work visa and stay in the UK for 2 years. So we want to really help you with shaping your ideas about your career, where you're going to go in this program and what you want as outcomes. So that's all very important. That is part of your induction. Then how we've structured the program is that, we don't want you just to get segued off into, your specialism. I think that would be a real missed opportunity. So we do use a flipped classroom process here. We don't want to be bringing you to campus to just be lectured at. So most of your lectures will be online. You'll also have case studies and other work that you'll prepare online. When you come to class, it's going to be quite interactive. It's not just going to be seminar discussions, but you will be interacting, debating, talking about different cases, using different kinds of tools, techniques, labs. So the in-course bit is really essential. So how we've done that is in term 1, you'll have 2 of your kind of core classes. And those, there are 4 in total. One is around leadership and management. One is around finance. One is around HRM. And one is around comparative health system, changing health systems. Those courses are offered across the two terms, term 1 and term 2. And then you'll take 2 modules in your specialism in term 1 and 2 modules in your specialism in term 2. And the reason we do that is we want you to get to know everyone. So each time you take a module, we'll be, having, and when you come to campus, you'll have different people in the classroom. So we want to really mix you up so that you get that kind of broader exposure, as well as have the opportunity to get to know people in your specialism as well. And the other thing is that you will work on a project, and the project will start at the beginning of the year. You'll work across. It's about really developing an idea of a health improvement. It can be inside a hospital, outside of a hospital. You'll take it really from concept to building the business plan. That'll be a full business plan, including your kind of financial costings, and also putting together a presentation and a pitch about that. That team will not just be in your specialism. It will be people from, so say you're in finance, you'll be working with people in leadership, and analytics. And the idea then is to really create teams that are very, multidisciplinary, so that you can learn how to work with lots of different kinds of people, very diverse group of people, to really take your ideas and your thoughts forward. So that's really exciting. And then at the end that you'll get to finish that up, write it up in term 3, and that'll be one of your capstone final assessments. You'll also in term 3 have a research project. And again, that's an individual task. So you'll be able to work with your program lead, choose a topic that will normally be in your specialism. So if you're in the analytics specialism, you'll probably pick a research project that fits within there, you know, and the same thing if you're in the finance or if you're in the leadership. So it's a wonderful program, and it's very, you know, gives you lots of opportunities. And we'll have different competitions and events throughout the year. We've got some amazing speakers that'll come in who are really quite big names in this space. So it'll be very exciting, as well as teaching you all sorts of new skills. So I just want to also take a moment and tell you just about our MBA, because I often get people who ask me, what's the difference between doing the MSc in global healthcare management and doing the MBA in health? So what is the difference? Well, first of all, the global healthcare management is really about honing in very specific skills, you know, getting the kind of managerial skills, but also then getting some very specific skills around healthcare management. The MBA is just that. It like all MBAs, and and this has been designed to meet all the association of MBA, you know, kind of areas of learning and competencies. So you get all the kind of general management and business skills that you would get in an MBA, but it's really focused on health. And so it's built into the DNA, it is the health. How does it differ? Well, this is taught in a very different way. It's very much about teaching you how to assimilate lots of information, how to, and then how to make confident decisions, presentations. It's really focused on, you know, building your leadership and management competencies for being a senior leader within a health organization. It also, you have 2 projects on this as well. You don't do a kind of a research project. What you do is you've got a one called the Global Health Challenge, and another one called the Health Consultant. And these are both projects where you actually have real world experience. The Global Health Challenge, you'll have a 2-week field experience where you're working on a project to find a solution in a low-income country or middle-income country, and you actually travel out there. So you really learn what it's like to be an international health consultant. And the health consultant, of course, is really how do you work to a brief? How do you work with a client? So you're getting a very different kind of skill set at a different level. So again, this program also has a different induction. It's a 2-week induction, much more focused on kind of careers, personal development, organizational behavior. It has a 3-day residential where you go off campus, you work with personal and group trainers, and you also will get an overview of just, you know, the kind of health landscape. You'll take personality tests and work with a career recruiter agency that will really help you visualize what you want in the program. Think about through the kind of tests that you'll take, your attributes and attitudes and how you want to shape them through your MBA experience. The program is also offered in a complete different style because it is an MBA. So you get 4 kind of blocks that you take. Again, it's very case-based. So you'll you know, come in, you'll prepare for your block, and the block runs over 4 weeks. It's about, you know, over 20, 25 hours a week of content during when the block actually runs in terms of face-to-face time. You'll have prepared many cases and done readings ahead of time. The first one, just to give you an example, is called Strategy, People, and Marketing. You'll come in, you'll get a week of strategy All these modules are taught by teams with health professionals, and also with people who are, business and management professionals. So that first week, you'll have prepared, you'll come in, you'll have speakers, interaction across the week. You'll learn about strategy and in its wider context. The next week, you'll do human resource management. The third week, you'll be looking at marketing. And then the fourth week of each block is what we call wrap-up week. And that's where we bring in health professionals who really bring it alive. They'll take you through interactive activities and cases, and really solidify your learning in those areas and put them in the context of health. So it's a really exciting program. Then you've got 2 weeks where you'll prepare for the next block. The next block is called funding, finance, and regulation. Again, you'll have accounting and financial reporting, but you'll have corporate finance, health, policies and practices, and then you'll have your wrap-up week. Then either in January or in June, depending on your project, you'll go away for your field study component, where you'll have an immersive experience in that country, learning about the health system, doing interviews, collecting primary data for your project. And then in term 2, you've got your final 2 blocks. The first one, data-driven health management. So it's health, it's economics and health economics. Again, analytics, data-driven, decision-making in healthcare, and then sustainability in healthcare in your wrap-up week. And then the final 4th block in this program is really contemporary topics. So students can pick from a number of different themes to undertake an intense kind of experience and study around them. So it's really exciting. It's a great program. And that's why it's important to see that one is an MSc and this is an MBA. And just, I've mentioned the Global Health Challenge. As I said, just to re-emphasize, it's a team project. You go on a field experience for 2 weeks. It culminates, you're going to be working with UCL academics, and you'll be working with industry experts. And it culminates with a kind of a paper and a presentation. And it's just a great experience to learn what it's like to actually be in the field and conduct that kind of research and consultancy. And then the other one is something that you'll do here with us, but it will be getting a number of briefs. All of these will be sourced for you, and you'll be working. We have a designated career consultant for our MBA program. They'll be working with you, and as part of this is making sure that the consultancy matches what you want to do in terms of your aims in your career, and also in terms of where you'd like to really locate yourself and kind of the knowledge that you want to get. So again, it's a brief. You'll work directly with the client and be delivering that. You may work alone or you may work with others depending on the project brief. And then we also have, of course, the question, well, who should do the MBA? Usually people do the MBA at 2 places. So they either do it early on in their career or they do it later, mid-career. We're really, for this program, we want ambitious individuals who want to be exceptional leaders in healthcare. It is a bit of a sprint, through the program. It's very intensive. It's got lots of activities, lots of interactions, lots of opportunities for networking as well with professionals on the program, teaching on the program, but also speakers coming in. So it's a great program for those who are really looking to get that MBA experience. Of course, it's got a whole different admissions process. Some things are the same, but there are definitely some things that are different. So you need, again, to submit your academic records. You need to have your IELTS test if you're coming from a non-English speaking country. We're looking for work experience. Ideally, we'd like 2 to 3 years minimum. And, we will take into consideration other work. There are people who work along while they're studying or have other kind of work experiences. So if you're not sure if you've got enough work experience, please email us and we'd happy to look at your CV and let you know whether or not you would be a good candidate for this program. We do require a well-balanced GMAT or GRE score, but again, there are some cases where we will waive the GMAT score if people can demonstrate through their transcripts and their CV that they've got the kind of quantitative skills that are required for really taking on an MBA. All the MBA candidates are interviewed, and then you need to submit also, of course, your CV, your personal statement, and we need 2 references here. So you might have an academic reference and you might have a work reference. It's a great program, and like I said, they're very different. The Global Healthcare Management, which is also a very good program, they're just really different levels and different kind of outcomes that you would get from these programs. So now I'd just like to take a minute and talk about funding. I'm just going to highlight a few funding sources. There are many other funding sources that you can access. So we do have a designated scholarship for the MBA. It's called the MBA Health Future Impact Leaders Scholarship. Of course, it's up to $15,000. If you were to get $15,000, and we have a number of these, it really brings it down for an international student to about the same price as an MSc. The reason we've got this scholarship is we really want to get exceptional students undertaking our MBA in health. And you can find out more about how to apply for this by looking at our website. We've also, and all of these scholarships, by the way, will be discounted against your tuition. We also have another one called Women Healthcare Leaders. And of course, if you've looked around the healthcare landscape, you'll quickly realize that women make up the bulk of the workforce, but they make up actually a much smaller percentage of our senior leaders. So this is really focused in helping people who identify as female to elevate their leadership skills, to prepare to move up to senior management and C-suite roles. So in addition to getting the scholarship, you'll also have the opportunity to get extra career coaching and other opportunities to engage. And last but not least, we've got an East London Healthcare Leaders Scholarship. And that's because this program will be taught on our UCL East campus. And we're, it's in kind of recognition and celebration of our community there. So other sources of scholarships, of course, if you're, a UK citizen, you can apply for loans through the UK. If you're a US citizen, you can apply for a federal direct loan as well to come to UCL. There are also, and I always say the British Council is a very good place to look for scholarships. There's also international student scholarships like the Chevening, the Commonwealth, Fulbright, great. And if you go on and Google UCL Scholarship Finder, you can find lots of scholarships that are available. So it's really, looking, and we also have a special event on scholarships if you want more information and more ways in which to understand. These are just a few that I'm highlighting today, but, it really, regardless, what funding. In terms of career opportunities, as I've already mentioned to you, we're going to start at the beginning of this program. We will really work with you to help you get the kind of career outcomes that you're looking for. Our career services at UCL are amazing. They have a number of sessions they run for our postgraduates in induction week. And it's really important, and I cannot emphasize enough, that you start at the beginning of your journey with us, thinking about where you want to go in the career jobs. We'll have a job board, resources. I've had a number of companies approach me about how they can have students in our school be interns. If you're an international student or a home student, you can work alongside your program. International students, through their Tier 4 visa, can work up to 20 hours a week. And then I mentioned that after you finish, you can stay in the UK for up to 2 years by getting a post-study work visa. So there's lots of opportunities to get and advance your career. We also have some really exciting programs. I mentioned the project you'll work on. Every project will have what we call an industry mentor. It'll either be an organization or an individual that will sponsor your team and work alongside you and as well as your academic advisor. We also have a very exciting program called Health Executives in Residence, and it's an opportunity for you to book office hours, book a 30-minute chat with various leaders within the healthcare space. Each semester, you'll have the opportunity to book at least 2. And these people are really excited to give you career advice and help you think about crafting and shaping your career in this very important space that really needs you. I cannot emphasize how much the labor market needs you. And then, of course, at UCL, we've got great alumni networks, and you can tap into that and talk to people who've gone to UCL and been in the health space. And we've got, if you're thinking of a startup or very interested in innovation and enterprise, there's so many opportunities to really engage in that space as well at UCL. So what are the kinds of careers that you might think about coming out of this program? Health consultancy is a very important area. It's expanding. Many hospitals and healthcare organizations and clinics have really turned to consultants to kind of get the advice, rethink their pathways, their structures, their processes, their costing models. So there's tremendous opportunity there. There's management roles, of course, big pharma, biotech, public and private health. If you're doing the finance route, you might want to think about going into finance, investment, particularly with a focus on the healthcare sector. Many of the private equity, mergers and acquisitions that are really driving many markets today are in the health space. And it is a major route, venture capital for health tech, med tech, startups in general. So there's lots of different ways. The health ecosystem is huge. It's expanding. New players, even new categories of patients are coming along all the time. And this is your opportunity to be a part of that dynamic profession. So before I conclude, I just want to say to you, UCL is an amazing place. We've talked a lot about the program, and for many students, maybe that's enough. But I can't emphasize that it's also a place to have a lot of fun, be a student. There's 250 clubs. I'm really hoping students in our global healthcare management will set up their own club. And, in addition to the societies, there's every sport you can imagine. And of course, there's also even opportunity for you to invent, innovate, and do new things that maybe haven't been done before at UCL. It's a welcoming place. It's a place where you can really, be your best. There's also lots of volunteering opportunities, ways that you can connect to hospitals, charities, get some experience in the health profession through giving of your time. And it can also, on a personal level, be extraordinarily rewarding and insightful. We also have great student support and well-being service team at UCL. Many of us today are experiencing challenges with our mental health and our well-being, and they have counseling services there that can support you. They can answer your questions. They can help you in lots of different ways. We also have something called Ask UCL. You can, if you don't know who to turn to, you don't know where to go, you can put your question in there and we will get back to you and give you the answers in the direction you need. And then, of course, the student union has their advice line as well. I just want to lastly talk about where we're going to be located. We will be, this is our campus. You will be taught in this building over here with the red, and this big tower is student housing that is available there as well. It's a beautiful location, lots of opportunities. It sits right next to, I believe it's the largest shopping mall in all of Europe, the Westfield shopping mall there at Stratford. There's some great restaurants. On the park are other universities and cultural and educational activities. There's sports facilities. There's the aquatic center. So it's a wonderful place to study and learn. And really my ambition as the director of the Global Business School of Health is not just to have us at the UCL East campus and using the facilities, but have us really use our location as a living laboratory for so much of what we're going to do. It's also just an 8-minute, ride into central London, so you have complete access to the Bloomsbury campus as well as this campus. And life in London is just tremendous. It's a beautiful city. For those of you who are not from London, you will find that the parks are excellent. There's so many things that you can do, museums, galleries, festivals, and much of it is free. So it's not surprising that London has been ranked the top city in the UK in 2021 through the QS rankings, because it is just a tremendous place. And there are so many other students from other universities. So it's just great to be a student and live in London. I hope you've enjoyed this presentation. And like I said, we're here to support you. If you've got questions, you just email us, contact us. We really do respond, and we respond right away. We want to make sure you get the information you need to make this important decision. And it is an important decision. It's a real investment in your future. And we take that very seriously at the Global Business School for Health. We have other information sessions. We've got a few coming up for the MBA. I mentioned to you scholarships, so I just want to highlight that. On February 22nd at noon, we will have a scholarships and funding information session. The other thing that I'd really like to emphasize is we've got a great webinar coming up in February as well on health innovation through capital and private equity markets. A really interesting topic, so I hope you would join us for that as well. And then finally, this is our email address. Check us out, send us a note, let us know what you're thinking. So that's really the end of my presentation. I hope you've enjoyed that. I'm going to stop sharing my screen now. I'd be more than happy if you've got any questions you'd like to ask today. Again, you can email us. We're always here for you. And so I'm just going to wait a few minutes and see if any questions come up. All right, one more minute. Again, and just quickly, I just want to add, you can take this program, the Global Healthcare Management, as a part-time or flexible student as well. So Peter's telling me to hold on. I'm holding on, Peter. Okay, don't raise your hand. I need you to type in. So if you go down to the Q&A function and just type in your question, that's how, and then I can answer it from there. Is the size of the class still around 35 for each route? We're planning to take between more around 50, I'd say, for each route, partly because we've got a lot of demand and we want to give as many students an opportunity to come onto the program this year as possible. Having said that, though, you will be taught mainly in seminar groups of about 25. So you'll have a lot of personal attention and interaction. Peter, is there any further information for us to decide between which route to select, as there is interest in all, where they are all valuable to our careers? Wow, that's a tough question. I think it really is such a personal decision, Peter. And I think it's thinking about where you want to go. I think probably, they're all important. And I think, areas like analytics, data is a really important area. So but it would depend on your background and whether that really suits you. But I think getting that kind of understanding and those competencies can be really advantageous. Of course, finance is always a good area to go into, but again, it depends on you. So, if you want to write us and set up a time to talk to somebody, we can do that as well. But I think it's really trying to visualize yourself. What do you want out of the program? Maybe not overthinking it, but also because you will get general competencies as well. But the reason, it's kind of a trade-off, right? We wanted to make sure that you could get your specialism, but also interact across the year with your colleagues on these more common modules. So you do have to decide on a route. Okay, the next question, Donatella, how is the part-time course different from the full-time? Well, the part-time is over 2 years. You would take 90 credits rather than 180 credits across the year. How that would work is you would take one of the kind of core modules and one of your specialism modules in term 1. And what we would try to do is make sure that you can get those all on one day, so you don't have to come more than 1 day a week to campus. And then you would take the same in your second term, depending again on your specialism. And then you would take in your 1 year, you might do the group project, and the following year you do the research project, or the other way around. And that's how. So essentially you get 30 credits term 1, 30 credits term 2, 30 credits term 3, and that would be split over 2 years. And we would work with you to get your timetabling sorted out across the 2 years, so you would know what you're doing and how it was done. So that's how the part-time works. Peter, also just for more insight into the school, what inspired you to your position at GBSH? Well, that's a great question. It really inspired me. I think it's the most exciting thing I've ever done in my life, actually. First of all, healthcare really is so important, and we see so many people around the world suffering right now due to inadequate healthcare provision. We have people who can't get vaccinated, can't see a doctor. We just see the health system so overloaded, and it really screams for different kind of business models. So given my career, particularly in economic development, working overseas, most of my career, I found that really compelling. And then secondly, the ability to, because I think that healthcare has to be reimagined. We can't just keep going on with the same business models that we have. We need different ways in which we approach and think, and also work across globally. So that, coupled with the idea of really being able to create something very novel, a first of its kind, to start with kind of just a blue sky, was so exciting, and I am so proud of this school and what we've just accomplished so far, and I look so forward to really engaging, getting our students, our cohorts on board. So thank you for asking that question, and it is really just a privilege to be the director of such a needed area. And I can't tell you, I have people write to me all the time, connect to me in LinkedIn about just, why no one did this before us. So, and I'd like to really believe that all these programs, by the way, are cutting edge. They're with a view for the future. They're with a view for where healthcare needs to go and is going. So thank you. Another question. I worked part-time at Waitrose during my whole bachelor's degree and planned for an internship for some experience in a startup. But due to the pandemic, my internship was canceled. I continued working at Waitrose for the remainder of my studies, and I was wondering if it is sufficient work experience or should I apply after a year in industry? I think that is, a really good work experience. I used to work in the United States. I taught at a university for many years. And I used to always say to students, it's more not about the actual job you do, but how you use those skills and transfer them into other things. And the reason, by the way, particularly with the MBA, why we require work is because it gives you a context, having those experiences, working with others, managing projects, thinking about how you get things done, how you work in teams. Those are all really invaluable skills. And it doesn't matter if you got them at Waitrose or you got them at a startup. And in fact, actually, Waitrose is a big company. So you may have gotten even more interesting experiences. So if you're eager and ready to go and want to start, the program, absolutely apply. Next question. Would you recommend students that work full-time to choose the part-time option rather than the full-time option? Or you think it's feasible to do the course in 1 year while working full-time? I think you might be setting yourself up for failure to try to do the course full-time and work full-time. I'm not saying it's impossible. It can be done. But you'd have to have your employer completely on board because there will be, days that you need to get off work and, to kind of come to class. And by the way, that's going to be the same if you're doing it part-time. So if you're not in a rush and if there's a particular reason you can't take off, you need to work full-time to get the program done. I think it'd be better to try to do it part-time, and so I think it's about sitting down, kind of mapping things out and being realistic about how much time you have. And some full-time jobs are very flexible. So maybe your job is, without knowing the details, but you're welcome to email us or set up an appointment to chat. But I just think sometimes, I know for myself, and I have done degrees and I did work full-time and do a full-time degree. It can be done, but it's a lot of work, takes a lot out of you. And so if you can do it part-time, I almost think that might be a better way to ensure your success. How many conditional offers do you plan to make to applicants? So, many of the students applying, particularly to the Global Healthcare Management Program, are people who are completing degrees. So we are very happy to give excellent students conditional offer so that while they complete their degrees. It's not quite like that. We're not giving conditional offers because the conditional offers that we're getting are to candidates that we anticipate will actually complete their degree. Okay, so I don't see any other questions. I'm gonna wait just one more minute because we do have a few more minutes left. So really, I just want to say you've been a fantastic audience and really good questions, good engagement. So if anything comes up to mind, just email us. We're here to support you. We want to help you, make very important decision. think about your future, think about the opportunity that the Global Business School offers you, and make sure that your expectations and our expectations match. So please never hesitate to send us an email, ask to book to talk to someone. That's what it's all about. That's what the admissions process should be about. So have a lovely evening, afternoon, morning, depending on where you're at in the world. Thank you so much. Take care. Bye.